gently lower your patient's blood pressure without causing your patient to crash, then Cardene is going to be your best friend. My name is Leah. I've been a CVICU nurse for 18 years, and in this series, we're talking about drips that we commonly see in an ICU setting. So Cardene is a calcium channel blocker, so it's great for post-op care of hypertension. It's also good for hypertensive crisis. It's a really good drug. We usually start at, most places I've worked at, it has the same parameters. Usually starts at 2.5 milligrams per hour, and you titrate up. Usually 15 is the top that I see. And so it's a really good drug to be able to titrate and watch, especially if you need tight blood pressure control, but you're worried about bottoming a patient out. You can use this drug and make sure your systolic stays under 140, but not be giving like a hydralazine or labetalol dose that once you've given, you can't take it back. So I like this drug for that reason. You do have a little bit of time after you titrate it that you are kind of watching, somewhere between 5 and 15 minutes. You're kind of watching to see what it does, and you're titrating up again, or you're titrating down. But the effects are pretty quick, and so it's not like once you give the dose, it's lasting for 4 to 6 hours. You give the dose, you turn the dose off, it moves pretty quickly with the patient. That's one great thing about it, especially in our post-op patients. They can be really labile in their pressures, and so you may not want a drug that's going to stick around for a long time. If you have a patient that is on that medication for quite a while, you need to start making a plan, though, for how you're going to get them off and onto PO medications. Maybe it just needs to be that they need to restart their home meds or something like that. But they can't stay on it forever, because at a lot of facilities, if they're on Cardene, they stay in ICU. And the whole goal of being in ICU is to get out of there. So continue to follow this series. We'll continue to talk about medications we commonly see in the ICU. Drop any questions you have in the comments, or anything that you see in real practice out whenever you're working. Like this video and share it with a friend.